One of the reasons that we like to keep you in the hospital overnight is to make sure that you are completely comfortable, at least during that first night after the procedure. You can receive anything you need for pain control at that point, and when you go home, you will be given a prescription for pain medications as well. You'll be given a full instruction sheet on how to manage things once you get home, many of those focus toward comfort. One of the main side effects after surgery is swelling, and that's normal. So we take a few measures to try to reduce swelling, the main of these just being ice. Ice and scrotal support or supportive underwear. That really goes a long way to help reduce swelling. Immediately after the procedure, we might even put a small drain in place to help reduce the swelling. The most important care factor for the incision site is keeping it clean and dry. Now, immediately after the procedure, you will have a bandage on there, and that bandage can be removed in about 48 hours after the procedure. At that point, you will be able to shower, although no baths. The complete instructions will be given to you in a typed out instruction sheet that covers everything from how to manipulate the implant, how to stay clean, what you can wear, and what you can do. It is very important for the pump to maintain a position in your scrotum very low down in the scrotum. And it'll be placed there during the surgery, but to keep it that way, it does require some participation on the patient's part. And that is to gently grab the pump in the scrotum and just manipulate it down toward the bottom of your scrotum. That actually starts happening about 1 or 2 days after the procedure is performed and continues until you're healed. Constipation after surgery is very common, and it's usually caused by the pain medications that we take, more specifically the narcotic pain medications that we take to cut the pain. So we try to minimize the narcotic use to help minimize the constipation. Also, laxatives can also be used in things maybe like stool softeners to help with that as well. There are very specific limitations to bathing, lifting, and other activities after your surgery. Now, you will be given a very detailed sheet of what to do, how to do it, when you can bathe, how to bathe. It's all very specific, but it's only usually during the first week. After that, you slowly get back to everything normal in your life. Your return to normal activities will actually depend upon what your normal activities are, depending upon if you have a desk job or a manual labor job. These will all be discussed with your urologist, but we do want to get you back in the workforce as soon as possible without compromising the success of this procedure. Typically, the majority of the recovery takes place during the first week after the procedure. That's when the swelling goes down, the bruising goes down, and then the following weeks are where you really get back into the normal activities of life. We always encourage our patients to call us if they have a fear or a question about anything that might happen post-operatively. Specifically, however, from our standpoint, we're looking for signs of infection, and that's going to be drainage from your incision, abnormal swelling in the surgical site or maybe your scrotum, or maybe redness or tenderness. Occasionally there might be fever. If you have any trouble urinating, those are also things that we would want phone calls about. After your procedure, we will take care of all the post-operative appointments, but in general, we like to keep you very close to our practice until you feel comfortable with your implant. And that may mean coming in once or twice a week after the implant. We want you to feel comfortable with your healing process as well as how to use the implant once it's time to start pumping it up and letting it down. Although our patients are very eager to use their implant once it's in, there actually is a healing process and a healing time that needs to take place, and this will be discussed with you before the implant is placed. In general, that time period is 3 to 5 weeks after the procedure, but that'll still be determined by your doctor during your follow-up visits. When you become one of our surgical patients, you actually have our entire office staff at your disposal. A specific question could be directed to me or my nurse. If I'm unavailable then any of the physicians here or the mid-level providers can also answer all your questions if something should arise.